So I am very excited to chat with a couple of guests, and we're going to really be talking about a serious topic here, depression, with a return guest, Dr. Achina Stein, and we also have Silvia Covelli. And welcome, Dr. Achina, as well as Silvia.
Thank you for having us.
Yes, thank you. Happy to be here.
Yes, happy to have both of you, and going to be a great conversation. I mean, just again, a lot of people suffer from depression, and that's why I wanted to, have you both on. Again, very important topic, and I want to start by diving into Sylvia's background, her backstory. So if you could, how did you so you're both, we're going to, towards the end we're going to talk about the Healing Depression Project, and so let's lead, how did you start being involved in this project, Sylvia?
Yes. So it's out of my personal story, actually, my battle with depression. I battled with depression for more than 25 years. I was able to do like, a lot of the things that I was supposed to, and I was functional regarding, my work and my obligations. But depression was always in the background, and in general, like posting like real, a lot of challenges in my life. During that time of like 25 years, I tried many different approaches, and I went, through, conventional psychiatry, pharmacological approaches, to, more alternative spiritual approaches as well. And really nothing seemed to work. At the best, some of those treatments or programs work temporary. So I would be, like doing better or feeling better for an X amount of time, but then symptoms will always return. So, and that's one of the things with depression is, it's just, it keeps coming back. And it's just this, this cycle of it. And about 5 years ago, I changed the approach to everything I was doing. I mean, I saw the things that definitely didn't work for me. Like in my case, medication didn't work, and actually, it made a lot of the symptoms worse. So that's something that I stopped. I had stopped many years ago. But then there were like other things that I found helpful, and I took like a different look at the situation. I reviewed the entire, like, when I went to see how many programs and treatments I've done, it was over 60 different ones. So I just, reviewed them and took the best out of them, and took like a really, what we can call like functional medicine approach, because he was really looking into, what is causing all these symptoms versus just, addressing the symptoms. And I just put a program together for myself to, as an attempt to go to feel better. It was, a lot of like nutrition, and just all these like changes in lifestyle habits, and again this look toward like root causes of, symptoms that I was feeling. Some of those symptoms were like physical, like a complete lack of energy, and just some days I would wake up and I will feel like, like an unplug machine, like I couldn't like function to do, some of the minimal things that I was required to do. So with that look, I put that together just with no much hope, because when you've been dealing with something for that many years and you have tried so many things, you think in a way that you're going to continue living with that. And that's something that is also part of my story. The messages that I found in doctors in conventional psychiatry were very discouraging. Most of them saying that I was going to have this condition for the rest of my life, that depression could not really be cured, but just manage the symptoms somehow, that I should make peace with it, and in their own words, learn to live with it. It's clear that anyone that says that has not like really experienced what major depression feels like, because it's not something that you can learn how to live with. So in that, with all that background, I just really did something completely different, where I not only I evaluated everything that I had done and I changed the approach, but I stopped my life as well. I realized I've been trying all my life to heal as a side job. I've been just really concentrated on my work and my ventures and family and helping others and being there for other people. And healing was always something I would do, maybe 1 hour a week, or I will make this effort on the weekend, or I will do this activity, or I will go to that 5-day retreat, or things like that. So what was completely different that this time is that I stopped my work and I fully concentrated on that, making healing my full-time job, like what I really had to do to get better. So to my surprise, even a month within, I started feeling different, and it took me a while to recognize my own healing. And then just 3 months within doing all these changes in my lifestyle, in my nutrition, and again looking at what was causing the symptoms, 3 months within, I could say that the change that I had was something that I had not experienced within the 25 years. So, and eventually all my symptoms went away, and I've been depression free since that time. And that's my story that actually motivated this project, the Healing Depression Project. Just at the beginning, I never thought I would be doing something like this. When you're dealing with this condition for so long, you're in a survival mode, and the only thing that you want to is to move away as far as possible from it. But now, about 2 years ago, I started feeling that maybe this approach could help others. And I remember the frustration I went through during all these decades of looking for help and not finding help, because actually the tools of the doctors were limited to medication and talk therapy. And in my case, that was not working. So I said well, this gotta be the story of millions of people out there. And we got together with amazing doctors like Dr. Stein here with us, and put this program together.
Mhm.
All right. That is awesome. Thank you for sharing. So, yeah, so you mentioned you are on the medication, antidepressant medication that made you worse. And then you said you are on 60 different treatments, 60 different
6-0.
treatments.
Yeah.
Wow.
It was 25 years, and I never stopped searching or looking. I was actively trying to find a way out. I kind of knew that I could, but just that's why I ended up doing 60.
Wow. Yeah. And then you eventually took a functional medicine approach. You said 1 month you started noticing a difference, and then 3 months in, really some dramatic changes. And today you're better. You feeling really good. Feel your
Yes.
symptoms, you said, have
Yeah.
resolved, correct?
Yes. The symptoms have gone away. It was
Yeah.
a whole person approach. It was very holistic. It was just taking care of the body, the mind, the emotions, and even the spiritual piece, all together. I realized that a lot of the things I have done were programs that focus on one of those areas, but at a different time, but never something that will comprehensively address all the areas. And that was also a big thing. And the other main breakthrough that really gave birth to this type of project, where we're doing it in a retreat setting, was the fact of the lack of integration that I was having. And for example, I knew I had a lot of information on things that were good for you. Let's just do like, meditation or exercise. Like
Hmm.
I had the knowledge. It was not, it was not that the doctors talk about it, but, I found out like through other sources, like how that's really good for depression. But then when I look at my life, the question that I ask is, if I was doing those things on a daily basis, if I was really like meditating every day, if I was doing that morning walk every day, if I was exercising every day. And then the answer to that was no. So that's also why I stopped everything. And I said, like, wait, if I cannot do this during my daily life, let me learn about how to form a new habit, and let me fully concentrate on this, on making this happen. So I think that was like a really eye-opening to see that I was not doing those things every day, and just being able to to put those habits one on top of the other and just work my way out and see. Even but with depression is really difficult, right? Because you have all these symptoms that make just the thought of like exercise or like sitting to meditate like a really huge task. So that's why like we put it in a retreat setting where we help, and it's like a hand holding system for the person to get into these lifestyle habits, just the way I did.
Hmm. Yeah. So, Dr. Eric, I think a lot of people don't realize that depression is not a mental health problem. It's not just a mental health problem. It's a very physical problem. And if you really look at the symptoms of depression, one major symptom is fatigue. And that was a big issue for Silvia. But the other physical symptoms are appetite problems, are sleep problems, concentration problems, brain, thinking problems, and joint pain is often included in symptoms of that come together with depression. It's not just the feeling of being depressed or having a loss of pleasure. It's important to look at it as a whole body disorder, not just a mental health disorder. And sometimes people have changes in their weight, as a result. And it's not necessarily because they're eating too much or not eating enough. It's actually a metabolic inflammatory condition that can affect your weight. And the other symptoms that come with major depression specifically are, besides a depressed mood and loss of interest, are feelings of guilt or low self-worth, and sometimes to this severe degree of suicidal ideations. And they tend to get more and more chronic and deeper and deeper and deeper. And so it's really important to look at it as a whole body illness, not just a mental health problem.
Thanks for explaining, because a lot of people think exactly that it is a mental health problem, that someone just needs meds or counseling. Even so, those are the two things: medication, counseling. But you're saying that there's the physiology behind it. You mentioned it's a metabolic inflammatory condition, so that could result in changes in appetite, changes in sleep, even joint pain. And
Mm-hmm.
so if all someone does is focus on the mental health aspect, I mean, they might get some results, but it sounds like they're
Right.
not going to get to the point that Silvia is right now.
Right. And that's why sometimes it's called treatment resistant. What treatment resistant? It's medication resistant. If you fail 2 trials of medication, you're then treatment resistant depression. And so it's important to understand that there are other treatments, and that depression isn't caused just by psychosocial issues. There is a biology behind it, and the physiology, functional root causes that can and should be addressed. And I believe that at some point in the medical and mental health care system, that these root causes will be addressed. There's a pendulum that's swinging in the other direction, getting away from, looking at the diagnosis and matching a pill to an ill, because people are just not getting better. Another way to look at cardiovascular disease has multiple mental health root causes. Stress, incredible stress, can cause heart attacks, can cause your cholesterol to go up, your blood sugars to go up. Stress alone can do those things. And it's not about cholesterol and eating too much fat in your diet. So there's so many myths about these things, and you're more likely to get better if you look at the whole person and what they're putting in their bodies, the environments that they're in, and looking at a combination of things, of foods, chronic infections, toxins, stress, all of which affect your hormones. Is really important to look at the whole picture and find all of the root causes and address each and every one of them. And that's what this program does. It looks at the mental health aspects in terms of limiting beliefs, looking at cognitive distortions, looking at the trauma and how it's affected you throughout your life. Trauma alone can cause incredible levels of cortisol, which then affects your body. And people have different patterns that come with depression. So metabolic syndrome is a pattern. Mitochondrial dysfunction is a different pattern. And autoimmunity is a different pattern. And so if you can address those root causes, you'll actually address the symptom of depression that is manifesting as part of something else that's bigger.
Yeah, no, thanks for that explanation. I want to ask Silvia how much stress played a role over the years, you think? I mean, I know it's hard to tie it and say just there's this one thing. I'm sure there were multiple aspects, but you mentioned meditation, like how you weren't in the routine of meditating every day and then eventually developed that habit. So how big of an impact do you think stress was when it came to the development over time of the depression?
I'm thinking. So it was a factor because I always had like a stressful life regarding work. And also, when I went to school, I was a young mother and, went through a divorce. So stress was always definitely in the plate of the things that I was going through. I also moved, quite young, like here to the U.S. And I was, I lost like all my connections to my family and my culture. So there were a lot of like stressors in my life. But the thing is that at the moment where life like got really better, where you would see like, well, those stressors are not there anymore, the symptoms were still there. So that's why this approach of really looking at what's happening in the body, it's like, it was like life changing, because it's not just managing like the symptoms, but really looking at what, just everything that Dr. Stein was just talking about, what, dysfunctions, unbalances, infections are happening in the body that are contributing to these symptoms. So for me, and it was actually discouraging when everything was going really well in life, I would get more concerned, because you would hope that during those moments, therefore, if there's that direct connection, at least, of course, I'm talking about my case, then, by default, my symptoms will go away, but they wouldn't. And then I will just sit down at some moments and say like, okay, let's see what's wrong. What's happening at this moment in my life. And for some periods, like actually everything was quite good. So, just looking at past that was amazing. And that's what really, really started to change when I took care of my body, through the nutrition, through the exercise, and through looking at what other possible conditions were there. But meditation play a significant role. I don't know if it was related to like as a stress management technique, but as calming the overactive mind. That's something that I had. It was this constant rumination and just this inner voice, this negative talk that I was not aware of. Sometimes it's pretty obvious, but other times it's a really smart voice that it doesn't really like, show the true colors to yourself, but it's something so just that is always there in the background, like kind of when the AC is on and you only notice the relief when you turn it off and you're like, oh my God, there was that noise all the time. So meditation really helped me with that, being able to control the mind, being able to not just let it go wild and have all these, amount of thoughts, constant thoughts. I think like, just Eckhart Tolle, when he talks about the overactive mind, he says that over 90% of the thoughts that we have in a day are, repetitive and just, exactly what we thought the day before and the day before. And that very few of them are actually thoughts that you need to, to perform like your daily task. It's just thinking and thinking and thinking. And so that's where meditation really helped me, just to build inner peace and just calm that voice in my head. So that was definitely a factor that contributed to my recovery.
Yeah, I think a lot of people have an overactive mind, not just when it comes to depression, but even just like people
Yeah.
have insomnia. That seems to be a problem too, where it just seems that at least that's what some people convey. I'm just thinking all the time. My mind's overactive, and so you're saying
Yeah.
that.
Sorry.
Okay, I was just
uh,
going to ask. So meditation could help with that. Are there any other techniques, Dr. Achina?
yeah. I mean, I think what I wanted to say was that there are a lot of people who are type A, or go, 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 or very physically active, right? Over exercising, and they might really enjoy it, but it's still very stressful to the body, and they don't realize how it's wearing them down. So so when we talk about stress, it's not just emotional stress, it's also how are you stressing the body. And meditation is really helpful, not just to calm your mind, but also to calm your body down. And and you're teaching yourself to become more self-aware in order to understand how your body, mind, and spirit is being impacted, so that you can then choose to make changes and respond differently. Instead of being reactive, you can choose to respond in a different way and make micro changes in your life so that you end up in a different place. So instead of putting out fires all the time, just putting out fires, taking a step back and like, well, why am I having all these fires in the first place? So I think it's really important to understand that meditation has multiple effects on
Yeah.
multiple levels. But it takes time for people to be able to get there. And there are those people who can't settle their mind down. It is a process, and they can't settle their bodies down. So there are other techniques, and and it could be doing things in steps. So tapping, emotional freedom technique, is a wonderful way, especially for people who need to move. They like to fiddle with their hands, and they have a sensory sensations really help them. So tapping is tapping on acupressure points, and different parts, starting up here, and there's a great app that you can download called tappingsolutions.com, and it's doing these patterns, learning these patterns of tapping on acupressure points and saying things like, even though I'm feeling anxious today, I completely love and accept myself. Even though my chest is tight and I'm breathing, short breaths, I completely love and accept myself. Even though my palms are sweaty and I'm trembling, and I'm feeling panicky, I completely love and accept myself. But you're saying all these statements while you're tapping. And sometimes there's going to be a point that feels really nice, and you might just stick there. It's like, oh, that felt really good. I'm just going to stay right here. This is just the classic pattern that I just showed you, but there's other places to tap. Sometimes it's just, karate chop point, So, but there's vagal nerve stimulation, humming, singing, just even walking, walking in a meditative way, noticing the sounds around you, the sun on your cheek, the wind going through your hair, the temperature of the air around you, and noticing the people around you. It's just kind of getting out of your head. There are wonderful methods to sort of calm the body down besides, and there's different kinds of breath work as well besides meditation. So many different kinds of breathing. Box breathing is the simplest one, where you're inhaling for 4, holding for 4, exhaling for 4 counts, and then holding for 4. And it's just basically, a box makes a box for a count of 4. I think everyone should start something for even just 5 minutes a day, and you slowly expand on them. And there's so many wonderful apps like Breathe and Insight Timer, Calm, Headspace. Just download an app and start doing it. And like I said, there is tappingsolutions.com. That's an app as well. Yeah.
All right, great advice. Thanks for sharing that. Silvia, getting back to you and the diet, like what changes did you make? You don't have to get too specific, but were you eating a relatively healthy diet over the years, or was it when you started taking a functional medicine approach that you really started making changes and cleaning up your diet?
So I thought I was eating healthy, and I think like a lot of people think that way. I'm talking with a lot of people that are calling, like, looking for help, and they all say like, oh yeah, no, I eat healthy, but then when you take a deeper look, it's not as healthy as it needs to be, especially for brain health. So I think the main change that really impacted me was I cut sugar out of my life. And it's not an easy thing because people sometimes associate sugar just with having an ice cream. But sugar is present in most of the things that we eat. And, just for one example, ketchup, that maybe some people are not aware, like, oh, that's sugar. That's a lot of sugar, actually, and in a lot of the drinks that we take, and so so on. The list continue. So I did an effort for addressing sugar. I also I started doing intermediate fasting, which intermittent fasting, I think. Sorry,
Yep.
Okay. So, and that really helped me with like energy, feeling like, just regaining the energy in my body. And the other thing is that for breakfast, I cut completely out. Of course, already there was no sugar, but I cut carbs as well, which eventually become sugar. So I was having a breakfast that was only protein and healthy fats. And that I do it up until today, and it's just I can feel the difference even today if I'm traveling or something and I had to have some breakfast with carbs. I feel it, if it's a bagel, for example, the kind of day that I have versus a day when I only break that fasting with protein and fats. It's a complete different type of day regarding energy, regarding concentration, regarding cravings. So those were the main changes that I did, and I became very obsessed with that to the point that I stopped ordering in or eating out. I was just cooking it myself, which I had not done before. So in the process of all this, I learned how to cook too, just because I wanted to make sure what type of oil was it in the food. So and so on. So regarding nutrition, that's what I did, and inspired on that, and of course, like so much like grounded research, we're doing metabolic psychiatry approach in our program, and that is ketogenic nutritional therapy. It's a specially designed diet, ketogenic diet for brain health, to address, the mitochondria disorders of the brain cells, and the cells in general, to address brain inflammation, and just to like really get you to reset that brain, to get those really needed good oils that the brain needs to function properly. So we're doing that. That ketogenic nutritional therapy during the 30 days of the program. And we're teaching people about the research behind this, and how important this diet is for brain health, how that also like reflects in their emotions, even in the way they're thinking, they're feeling, and how they can replicate this diet at home. So it's a training too. We even have like cooking lessons to help people to really do this after the retreat. Because going back to my story, what you don't integrate, then it doesn't have a chance of working, because just knowing that something is good, unless you actually go and do it, then it won't give you any results. So the program, the way we put it together, is first is a deep dive into your body, with a lot of like lab testing, and Dr. Stein, as a researcher, like a investigator, looking for all these root causes in the body, like what's happening that needs first of all to be addressed. Because if there's something that is not functioning in the body, it doesn't matter how much therapy you're having. Like, for example, if there's a hormonal imbalance, you're going to be feeling terrible regardless of how much other work you do. So we do that. Then we also do the ketogenic diet, and we teach, as a training, how you can do all these things when you go back to your life. Because our goal is for long-term healing, which is what I really managed to achieve. As I mentioned, I did a lot of programs, and some of them were good, but the relief was always temporary. So what this program is designed for is for people that have the so-called treatment-resistant depression or chronic depression, so that they have been experiencing depression for many years, and that are ready to fully concentrate on the healing, and that are willing to do this work, the work that it takes to get better, and will help them to how to change those things in their life, and how to integrate them when they go back. Because that's what's important. Which of these habits and which of these things are you going to really maintain, sustain when you go to your day-to-day life? And that's what's going to really be the main factor of finding long-term relief from symptoms.
All right. Well, thanks you shared a lot there, so I appreciate that. And Dr. Achina, did you want to expand on that at all? Anything regarding like the functional medicine testing, or anything else that you wanted to talk about before because I definitely want you to talk more about the Healing Depression Project, how people could learn more about that. But before we do that, I want to make sure I don't know if there's anything else that you want to share.
Yeah, I mean, we're going to be doing testing, so that we're not guessing, right, to figure out what the root causes are, whether it is nutritional deficiencies, or chronic gut infections, or oxidative stress, or mitochondrial dysfunction. or, imbalances in hormones, particularly, adrenal imbalances, thyroid imbalances, of course, right? So, and sex hormone imbalances. So looking at how it all comes together for each individual, and it's always different. It's always different. So yeah, we're definitely going to be doing comprehensive testing, blood work, urine, and stool testing. And if there's something that comes up in the history, we'll investigate that as well. So if they live in a moldy home, I'm going to get mycotoxin testing. If they've had a history of tick bites, recently, then I might include Lyme and co-infections testing. So it is the history that we'll be gathering, which is a lot of history. Each piece of that history is a puzzle piece of that person's life, their exposures to their environment. They might have an occupation that exposes them to things. So we might get some environmental testing. So it depends on what it is that the person has been through in their life. And the way to do that is to gather a lot of information, put it all on a timeline, and see how all the pieces are connected. And, usually we're able to find where the perfect storms happened in their life. And the focus would be primarily looking for how this has affected these changes in their life may have come together as a perfect storm affecting their gut, which is where 80% of the microbiome is, and how that gut is connected to the brain. 80% of your neurotransmitters are made in the gut as well. So, it's all connected. It's not just the head bouncing off along, not connected to the body. And, and we don't have just neurological cells and mental health cells. It's all one cell. And, one of the things that I wanted to say about the ketogenic diet is sometimes people balk at the ketogenic diet, but there's actually a lot of research in terms of the ketogenic diet being used in children for the treatment of epilepsy, refractory epilepsy. And so, now there's a huge amount of research going into the ketogenic diet for the use of mental health issues, not just depression, but also bipolar disorder and schizophrenia. And, sometimes people think they have these ideas about what the ketogenic diet is, that it's an all meat diet and it's unhealthy, but it simply is a diet that has approximately 70-80% of fats, 20% of protein, and 5 to 10% of carbohydrates. But these are healthy fats, healthy proteins, and healthy carbohydrates, mostly vegetables. So this diet is excellent for metabolic syndrome, as well as type 2 diabetes and some hormonal disorders like PCOS. So if a person has depression and these conditions, it's not that the depression's going to go away, just depression. These other syndromes, conditions will also get better considerably and even have significant weight loss. But if you put these habits into place and actually practice this in a sustainable way that feels right for you and an alignment, it's not just a treatment and then you go back to what you were doing. You have to, this program is to help you create habits so that it feels right to you. It's an alignment of what of what your beliefs and, and you want to do it because, wow, I can't wait to do it. Not, oh, I'm doing this because the doctor said so. I am doing this because it makes me feel good. Sometimes people also balk at like, oh my gosh, I can't not eat sweets or sugar. It's like, but if it's poison to you, if you actually change your mindset as this is poison to you and your children and your family members, like I look at Oreo cookies as poison. I look at milkshakes as poison. I would never eat an Oreo cookie. To me, when those are given out to kids, it's like, oh my God, it's just really, so it is a change in how you look at what we have been calling food. Food is supposed to be nutritious and delicious and healthy, not just tasting good or delicious.
Yeah, definitely agree. And you're right. It is a mindset thing where just, I mean, I grew up eating Fruit Loops and drinking Hawaiian Punch and all the other junk, and it was
Mhm.
just normal. It was normal to me. But I mean, definitely don't do that these days. And it just was
Mhm.
changing the mindset over time. I mean, it also, my Graves' disease condition played a role in, in changing my diet,
Absolutely.
but yeah, but again, it's, yeah, I appreciate you sharing that. Quick question about ketogenic diet before we wrap this up. And um, do you look at ketogenic diet more of a short term, like a month or 2 or 3 months, or is it something where some people can follow for 6 months or longer?
I think it's a great diet. It's a great question because we don't know. And I think it's an individual decision of how much people need to change their diet in order to affect a change. And it depends on what the target is. So if the target is simply not being depressed, then that might give you a certain, that might be a certain diet. But if the target is to lose 50 pounds as well, right, then that might be longer. So I think it depends on what the target goal is, because the ketogenic diet is a wonderful diet for resolving multiple conditions, different conditions. But there's also making having this diet in place to reach the goals and maintaining it for a certain period of time, and then trying to see what happens if you were to add back certain foods and having more carbs in place and finding your sweet spot. And just so when we do the ketogenic diet, we're also going to be following ketones. So ketones is a great fuel for the brain. It bypasses the blood brain barrier very easily, whereas glucose requires insulin. It's sort of like going into a dance, a nightclub, right? You got to buy tickets. For glucose, glucose has to buy tickets, the insulin, whereas the VIP of ketones can walk right in. They don't have to go past and get a ticket. So the ketogenic diet provides that the ketones for the brain as fuel. And so while you're addressing the metabolic issues that have resulted in not having insulin resistance, it's usually the reason why people have metabolic syndrome is because their insulin levels are so high and they've developed insulin resistance that when glucose knocks on the door, it just doesn't get in. So you can supply the ketones, and while you're addressing the metabolic issues so that your brain can respond to insulin, become insulin sensitive, and then allow the glucose to come in. So it's finding that balance. And again, everybody's different. It depends on how insulin resistant you are. And it's insulin resistance shows up differently for different people. Some people are thin. Some people are very, very overweight. So it's a matter of figuring out what it is for that particular person. And we start off the ketogenic diet, not necessarily right off the bat. You can start just by removing sugar and all the ultra processed foods, and then slowly reducing the grains. And some people won't even need to go to a ketogenic diet, classic ketogenic diet. So just by bringing down the carbs and increasing the fats can make a big difference. And it's healthy fats that are really important to introduce, not the unhealthy fats.
Yeah.
And that could be a whole nother lecture.
Yep. All right, so let's talk more about the Healing Depression Project and how can people find out more about that?
Yeah. So it's a 45-day program, 30-day at a retreat setting in Austin, Texas, and then 15 days on a daily follow-up when you go back home, when the person goes back home, to really help them implement everything that was learned during the retreat on their day-to-day lives. So next year we're running 2 of these 45-day programs. One is in March 2025, And the second is August, September of again, next year, 2025. So it's only 15 people per program, and there's an application process just to make sure that the program is, a good fit for you, that is going to really like help the person. And the way to get started that process is to go to our website, which is healingdepressionproject.com. And there you're going to find a place where you can book a discovery call. This free consultation with myself or with Dr. Stein. And we just at that point is just listening, a little bit about your story, where you are at, and just answering questions about the program. So that's the way to start the process, just to book a call with us. And from there, then, if the program is a good fit, we'll send you an invitation to apply. For March, we still have spots available. And something that is really great is that we have scholarships available, because residential care in the U.S. is really expensive. So we managed to get really good scholarships that can cover up to 80% of the cost of the program. So this might be the opportunity of making such an immersive program like this affordable. So we invite you to check our website, check our program, and just start with a call with us, and hopefully apply for the program.
All right. So healingdepressionproject.com. I'll of course make sure to include that link in the show notes. And yeah, thank you both so much. I think this was a great conversation. Again, an important conversation. And yeah, so again, everybody check out healingdepressionproject.com for that. And you said it's a 45-day project. 45-day program, 30 days in Austin, and followed by 15 days of home care, correct?
Yeah, that might seem like a long time, but the thing is that we're talking about depression that's been going on for years, people that have tried different things and they haven't found a solution. So this approach is specifically for that you invest 45 days of your life in order to get, the foundation of a complete, new life where you can be like healthier and happier. So that's why it's 45 days, because you really need to work on it. And I think that's the other message that I would want to give now towards the end, that the dream of a magic pill fixing depression or any other chronic condition, that is just that. It's just a dream. That's not actually for these kind of conditions. And I learned it myself. You have to put the work. You have to do, significant changes in your life. You need to take a deep look at your health in all, dimensions. So that's what the program does, and it really helps the person to change all those habits, which is a must in order to recover from depression. But just for people to know, if anything, that from this podcast, that they know that there's hope, there's new treatments out there, that it is not true that depression cannot be cured. I heard that from many doctors, and I can't say it enough. And it's not only my story. I run into, people every day that have done the same. So it is possible. There's a way out. Doesn't matter how long it's been going on, you can still have a life without the symptoms.
Mm-hmm.
Yes. Well, thank you. Again, thank you both, Silvia, Dr. Achina. Great having you. And again, everyone visit healingdepressionproject.com. And again, thank you so much.
Thank you.
Thank you for having us.
You're worth it.